আপনাদের সমস্যা দূর করতে আমি শ্রেয়া চলে এসেছি আজকে দ্য মণিপাল হসপিটালসে দ্য লঞ্চ অফ liver and digestive disease disorders liver care center. Sir, sir, I want to know that what is the vision behind this to open this liver care center?
So there is an increased incidence of liver problems throughout India. The main causes of liver problems, as we all know, the first and foremost is alcohol, and till recently the second causes were viral disorders like hepatitis B and C. But now that is decreasing in trend because of better medicines that are available. The second commonest cause of liver problems in India is something called fatty liver in general terminology. In medical terminology, we call it metabolic associated steatotic liver disease or MASLD. This is a lifestyle disorder. So this is one of the commonest causes. And there was a recent paper that was published from Siliguri by a gastroenterologist, where when he studied the total number of patients with cirrhosis, that is liver damage, the number one cause was fatty liver. So that is going to be in a few years probably more than alcohol because of the lifestyle problems. Because India is the diabetes capital of the world, and of the poor dietary habits, sedentary lifestyle, it is going to be an epidemic. So because of this, the incidence of liver disorders is increasing. So one, incidence of cirrhosis is increasing, that is liver scarring. Second, also incidence of liver cancer is increasing. So the idea behind this is, with these disorders increasing, majority of the people in this part of India, in West Bengal as well as the northeast part of India, are either travel to the southern part of India or the northern part of our country to gain access to further treatment. The goal with this is, with the help of collaboration from different Manipal hospitals, that is from Bangalore as well as here, is to establish a liver care center so we can cater to these disorders locally rather than have patients travel. And also have a collaboration where we are able to manage most of them locally, and maybe certain patients which cannot be managed locally, we can then have them come to Bangalore with collaboration and have them treated in Bangalore. That is the aim. And finally, establish a regular transplant center which can cater to these patients locally.
Sir, liver care center.
Sir, I want to know that what are the key facilities you people get here for a better lifestyle and better
In Manipal Hospital?
Yes.
Key facilities in the sense, now there are about 4 or 5 Manipal hospitals. So what we are trying to do is establish a collaboration between all the different gastroenterologists, that is Salt Lake City, Broadway, EM Bypass, as well as Mukundapur, and have them refer all these patients with these liver disorders to the liver clinic, which is going to happen once a month. And they will also be in touch virtually, where they can reach out either through a WhatsApp call or a video consultation if they have any patients, and we can then set up an appointment for these patients. If they can wait, we can see them in the liver clinic. But if it is an emergency, then we can have a video consultation in advance and see if these patients can travel to Bangalore in advance. And like Dr. Sethy said, in terms of the gastroenterology services, all the facilities like endoscopic ultrasound, ERCP, manometry, and everything is available. And even the surgical services, like there is a robotic surgery available, robotic surgery is available. So in terms of the surgical services, everything is available. The only thing that we would like to add to that is the availability of liver transplant.
Sir, I want to ask that what would you advise the people to prevent this digestive disorders or this
Liver
liver
disease.
disease?
So the main things for liver disorders, obviously the number one cause is still alcohol. So there is no safe amount of alcohol. So we read a lot of times saying 2 glasses of wine is safe or 2 glasses of beer is safe. Nothing is safe. So no amount of alcohol is safe. Stay away from alcohol. That is number one. Healthy eating lifestyle is very important. So our general diet, especially in West Bengal, we love rice, and so does in South India. We all love rice. So we need to reduce the amount of carbohydrates that we are having. So the smaller the size of grain, the better for you. So rice and wheat is not good. You can have rice and wheat, but not 3 times a day. So millets, ragi, jawar, bajra, quinoa, these are better. And also high protein, so eggs, egg white, chicken and fish. You know, Bengalis love fish, so fish is wonderful. So consume fish regularly, chicken regularly. So a lot of protein. In addition to that, vegetarian, you have sprouts, soya bean, paneer, dahi, dal. So protein needs to be consumed, and you have to regularly exercise. Exercise is not only walking. You have to lift weights, you have to build muscle. So that is what maintains your liver healthy. And in addition to that, if there is one drink that I can recommend, is black coffee. Black coffee is very good for your liver. That is without milk, without sugar. You can drink 3 to 4 cups of black coffee a day. That is very good for your liver.
Okay, sir, but is it for the youth or is the other people? Because the youth is more into the fast food things like outside food, pizza, burger, this, and the household food. And people also in the house, like today, they ordered it home delivery. So, how to suggest to people that so they could recommend something that they should introduce their lifestyle to prevent this?
So it's very important. So the increased incidence of fatty liver or the metabolic associated steatotic liver disease in India is because of these two things. One is poor food habits, and second is a sedentary lifestyle. So we have to modify this. This is not going to happen with. It has to come from within. So you have to stop ordering snacks. There should not be any snacks in your cabin. अगर snacks रहना है, fruits रह सकता है और some healthy snacks. So if you feel like snacking, you have to eat these healthy snacks. It can't be Lay's potato chips or anything like that.
I want to ask that if people want to eat snacks, what kind of snacks do you recommend?
So snacks can be dry fruits. Snacks can be some fruits. You can have dates. So things like that I would recommend rather than having any sort of fast food or a pizza or a burger. And you have to exercise daily, 5 days a week, 150 minutes in a day.